Cultural awareness, meaning the ability to be sensitive to the differences that exist between cultures, plays a critical role in healthcare.
How do you do? My name is Dr. Horgan. What seems to be the issue here? What's the problem?
My wife, pain, much pain, belly.
Is she pregnant, or was there an accident? Or what was,
No, it's much pain.
Okay, well, I think we should examine her. Do you want to help take her clothes off?
Yes,
We'll get that going.
Can I help you get your sweater off?
No.
Mr. and Mrs. Begic are from Bosnia, and they are Muslim. Mrs. Begic speaks almost no English, and Mr. Begic speaks it fairly well, but with a heavy accent. Their culture demands a much higher level of modesty than is common in America. We will see how cultural differences can make it hard to communicate important information about health needs. In this program, we will look at the role of cultural awareness in healthcare and show why it is so important that healthcare workers are comfortable and sensitive regarding these differences.
LEARN is an acronym, and the letters stand for 5 guidelines. L is the recommendation to listen with sympathy to the patient's perceptions.
I'm sorry you got upset. Can you explain to me what the problem is?
You must understand, only husband, God say, only husband look at wife. Other men, no looking at wife. You understand?
Okay, so your religion doesn't allow...
Yes, my religion, no, only husband.
E is to explain your own perceptions of the problem.
So if we get a female physician, a
Woman
woman,
doctor.
Okay.
Woman doctor, very good.
she can examine your wife?
Yes.
Okay, because your wife is having stomach pains,
Yes.
and we need to examine her and get a blood and urine sample to find out what's wrong.
Very good.
Is that okay?
Very good,
That's
thank
okay?
you.
Okay, so I'll go get the doctor.
A is to acknowledge and discuss any differences between these two views.
Mr. and Mrs. Begic, this is Dr. Lynn.
Hello, nice to meet you.
Nice to meet you.
Miss Begic, nice to meet you. I'm sorry you're not feeling well.
Mr. Begic, this is a gown and a blanket. If your wife can get undressed and put the gown on, then she can cover with the blanket.
Yes.
And then you can just leave the door open, and we'll know you're ready and she's properly covered. And we'll come back for the examination.
Okay.
Okay?
Leaving door open.
Okay. Thank
Yes,
you.
Thank you.
We'll just be right outside.
Thank you very much.
R is to recommend a treatment or course of action.
Mr. and Mrs. Begic, the results are back from the blood test, and there appears to be no infection, which is very good. However, there is a small amount of blood in the urine, and the kidney functions are elevated, which may be kidney stones, but in order to be sure, we're going to have the x-rays.
And finally, and crucially, to ensure compliance, N is to negotiate with the patient in such a way that his culture is respected, yet the recommendation will be accepted.